we get a lot of questions and all these things. So I'll try my best to answer many things. So, but why we are here? We are going to talk about basically pain, and also we are going to talk about what you mean by conscious breathing. So the whole concept, what I'm telling you, is nothing new. So these things are thousands of years old. So this is not nothing new. I'm going to talk about. Maybe if you did not hear this way, maybe the way I'm talking could be new, but this is nothing new. The concept is not new or anything like that. So in the past, uh, whenever I was going to school, so they will classify and define pain. They will call as an acute pain, and they will talk about chronic pain. And usually, the way we understood when we were going to school, they will tell us, hey, every pain start as an acute pain. Like if you don't have much pain, your pain intensity goes high up. And then after a few weeks, it's supposed to get better. If it does not get better, it turns into chronic. So there is a lot of flaw in this concept. Yes, it can happen this way. They're right. Yes, it can start with the acute pain. But unfortunately, that happens only 3% of the time. When you get trauma, you get injury. Obviously, you have an acute pain. But if you think, and I think we are doing this through fibromyalgia group, and that is just a name and a diagnosis. And many of you, if you think back, you really don't even have a clue how the pain got started. So telling that all pain starts as acute and they turn into chronic, it is completely wrong. In fact, right now, we have 50 years worth of scientific research to debunk this. So the truth is, yes, pain can happen as acute 3% of the time. But 97% of the time, pain is a process. It can start as chronic. Like anybody who have fibromyalgia pain, or they're talking about fibromyalgia, all your pain start with a chronic pain. Okay? Now, this is our thought behind this. So pain is bad. Yes, pain is a sensation. Most of the human being, we are programmed to dislike it. Why? Like, that's why all our reflexes is geared towards pain. So if you step on a hot coal or anything hot, this is the protective mechanism to keep you safe. Or you get kind of a walking and you will step on a nail. So you immediately move your feet up because that is a protective mechanism. But anybody who is having chronic pain, the protection is gone, you just stuck with the pain. Now what that is, how that is, I'll try to make a little bit sense today. Because as I said, pain is bad, that we already know. And over all these industrialization and all the scientific discovery, we get stuck in two things. We want things to be comfortable. So anything we do, now we are able to talk here this way. That is the advancement of science. So things has to be comfortable and things has to be fast. And when we take these two principles and put it on the pain, we are on the serious trouble. So I hear this every single day, many times. People say, well, I have pain, and you just take care of the pain or take my pain away. If the pain is gone, I'm fine. But unfortunately, things does not work that way. So pain is just one symptom. So before you get to the pain situation, there's many other things had happened. Pain is the end result of a long process. So if you don't know how the pain happened, you are experiencing pain today. So maybe a process start many years back. Sometimes it could be a month, sometimes it could be a year, sometimes it could be 5 years, sometimes it could be 10 years. So it happens. And there's a lot more contributing factor when you have pain. So pain is just a signal telling you that something is not right in all of your body. So when you're talking about all of your body, it could be many other things going on. So this is what we try to do because that's how we've been programmed over the years since our childhood. So if we have a fever, we need to reduce the fever. If we have a pain, we have to reduce the pain. If we feel we are heavy, I have to reduce weight. So these are all kind of bits and pieces, but our body does not work that way. We are not like a machine. We are like a garden. In a garden, you have to take care of the garden every single day and you have to nurture it. So that's how our body is. Pain is just a messenger. It is just one signal. Okay. So in the whole area of process, one thing do happen. So if you have pain, you think about this, or you can message me or anything like that. Many things do change, and something we don't even aware about because we don't have the body awareness. That is something we lose. So pain, no pain, whatever it is. So the first thing that changes is our breathing pattern. So if you really want to know what is a breathing pattern, you need to look at a baby or a child. See a baby is sleeping or laying down. Their stomach is visibly is going up and going down, going up and going down. Their stomach breathers. Because for the stomach to go up and down, the diaphragm has to expand. So a little bit about breathing and how it is so important. I talk about this for many years, 10, 20, 30 years. And we know about all these things at least minimum 3,500 years. So this is nothing new. So breathing is basic thing in life. So this is how we say somebody's breathing, they're alive. Not breathing, they're dead. So breathe is basic form of life. If we don't breathe, we are dead. So for as a human being, it is a simple mechanism. You have the lungs inside your chest cavity. In chest cavity is kind of a vacuum. On the lower end of the vacuum is made by the diaphragm, and the upper end of the thing we have this thoracic diaphragm, what we call. So that is a vacuum. So when this area of the chest, everything expands, so the air goes through to the lungs. And that is how our whole life revolves around. So in order to expand this, the whole area, so you can expand it from the bottom or you can expand it from the top. So from the bottom, it is the diaphragm. And this is where most of the load ideally should be coming from. So when your diaphragm lowers down, then you get more volume in your chest cavity and the air rush in. Now, in case if we do not use the diaphragm much, so the next best thing will be expanding the chest, your rib cage. They are expanded. And in worst case scenario, when these two things are not working properly, we have other things to pull it, like pry it open. Like if you don't have a cutter to cut your can of food, what you do, you take a crowbar. I have done that before. I couldn't find my cutter, and you just stab it and you try to pry it open to get the food out. So we have these emergency techniques are there. So what that time happens, so all this muscle, which we call as accessory respiratory muscles, they usually do not come into play. But in worst case scenario, they will come into play. So all this neck muscle, we have the anterior neck muscle, we have the side neck muscles, we have posterior neck muscles. They try to pull it up. That time we grasp for air, do like that. Now, if you have pain, no pain, does not matter. This is what happens when you are under stress. So So the stress does not have to be environment, how you are feeling. Are you anxious? Are you stressed? In kind of stress, imagine in the old time or even now, so a person is chasing you with a gun or a tiger is chasing you in the wood. So there is a stress response happens. So the blood pulls out from everywhere that goes to your extremities because you are ready to fight or flight. You are ready to run or you are ready to fight. And then the same thing happens. You need more oxygen because you need the blood to be oxygenated so that you can fight or you can run. So these are all stress responses. So one of the stress responses do happen when we use all our muscles because we need more air, we need more oxygen. So that time, all the accessory muscles, they will started working really, really hard. But if you are in a continuous stress mode, so we will stop diaphragmatic breathing. That is the first thing that will happen. Our breathing pattern changes. So we stop diaphragmatic breathing. So maybe we do breathe somewhat from our chest and somehow from here. That is your accessory muscles. They are firing up. They are working hard. So this is what happens when we are in a continuous stress. So that's what happens. When you're a baby, you are perfect. You are breathing right. Everything is going on. So when we get older, it is nothing to do with the age. Wow, our body changed and how much stress we are on. That's how we started treating more and more. We started breathing from here. So when your neck muscles tight, obviously many other things are going to happen as a process. This is the time maybe you started having neck pain. Maybe you started having headaches. Maybe you are starting going to shoulder pain. But everything begins with breathing. So in yoga, many of you, if you have done, that is called pranayama. And that is first thing they try to correct. So yoga, science, whatever, we are talking the same thing. So if you are under a lot of stress, this is what it is going to happen. And now, talking about the recent, what is going on in COVID-19, you can see those people's lungs are compromised. Maybe your lungs is okay, maybe you are just in stress. So if you always feel stress, your lungs will be compromised. It's not me. It is when. It's, it will be compromised. And those who are compromised lungs, they will be have hard time to get over with this virus. So it is affecting many people. Some people are getting better. Some people are not getting better. So we know for sure certain things what CDC is saying, like if you have diabetes, you have high blood pressure, if you have other kind of respiratory illnesses, it is affecting you a lot. But many a time you will see people of unknown thing, like they do not have all those criteria, but they are still getting into trouble. They are not able to get back or to recover. And this is the reason. So doing certain kind of breathing exercises every single day is not a bad idea. It does not matter what you believe. You believe yoga, you don't believe yoga, I don't care what you believe. So it is not about belief. It is about doing the right thing. And this is about the health. So it begins with breathing and it ends with breathing. If we cannot normalize a normal breathing pattern, nothing else is going to happen. This is what we do it in the clinic every single day. With the telemedicine, what we are doing now, in fact, today I saw someone in telemedicine. She was our past patient. The first thing she said, well, I'm having a hard time to breathe. Well, this is the springtime. So this pollen, what is going on, it is affecting all of us because the pollen count go to 0 to 1,000,000 in a day and is not getting any better because more and more flowers they are blooming and more things are happening. Why it affects someone and not affect someone? Depending on how is your breathing pattern is. Are you normally breathing? So what are you talking about normally breathing? That if we think we breathe unconsciously, well, that is another topic we are going to talk some other day. I'm not going to talk about that. We try to do everything unconsciously. We don't pay attention. We just do like a machine. So breathing does not have to be one of them. More we consciously breathe, more we know how we are breathing, more we pay attention how we are breathing, that changes everything. So if you are not breathing right during daytime, so the same pattern going to get worsened in the night. And this is what going to put more diagnosis, more name. Then you'll have sleep apnea. You are not sleeping well in the night. You are waking up more tired. You are getting up more tired than you went to bed. Then breathing is just one of these things. But now on top of that, if you have pain, you have other issues, then it is going to heighten up. So, in my opinion, breathing is a good point to start. I understand many of you have many problems. Yes, but we have to stop thinking the way like how we were being told. Your pain is bad, take away the pain. My breathing is bad, fix it mentality, fix my breathing. So what we have problem, that's we have to fix. But I'm tell this thing for years, I'm going to tell it again. It does not work that way. You have to fix everything. In fact, nothing is going to get fixed. What happened, changes happen. When you are a baby, you are breathing before that way. So what happened over the year time? Things have changed. And all these changes are not always physical. How we feel, how we respond to this stress, all these things plays a big role. So coming back to the point of breathing. So as I told you, we normally breathe diaphragmatic breathing. Then all these things plays some role, but not much. And the accessory muscles are usually does not play pretty much any role. So if you are under stress, pain is also a kind of a stress. So I cannot tell you chicken or the egg. Because of your pain, you are breathing from here, or you are breathing for it here, you get pain. But it does not matter. It does not matter how you do it, why it happened. But one thing I know, things has to be normalized. Until unless you change some way, somehow, backward, nothing else is going to change. Now, coming back to the breathing, there are simple things are there we can do. So I'm going to show few simple exercises of breathing, which is going to make more aware about your breathing and breathing pattern. Okay, and you can do this at home, and this is a good time to do it. Don't worry too much. Don't think too much. Don't put your belief this that. You know, just do it, and this is going to help you. So first, you need to check your breathing pattern. So for this, you need to sit somewhere where you are comfortable. So if you can sit cross-legged with leaning somewhere, you can do that. If you cannot sit cross-legged on any floor, that's okay. Find a place where you are comfortable, in a chair, maybe in a couch, maybe in your bed. But bed is a little bit difficult because it's kind of soft. So find a firm place to sit down. Okay. Then you sit down there and you close your eyes and try to listen how you are breathing. Try to realize how you are breathing. And don't be in a hurry. If you cannot figure out, that's okay. But try. That is the beginning of your conscious breathing. Try how you are breathing. Are you breathing from your stomach? Are you breathing from your chest? Or you are breathing from your throat? Pay attention. Or you just cannot figure out. That is number one. Number two, how you are breathing. Are you breathing deep? Are you breathing shallow? Or are you grasping for air? Number three, do you have a rhythm on your breathing? Do you have any rhythm? Or sometimes you are breathing shallow 2, 3 times, then you are stopping for a few, seconds, or how is your rhythm of your breathing? So if you find that out, this is simple. So you just find out where you are breathing and how you are breathing. So this is something to pay attention to, because what you are looking for change, this change may not happen in one day. This is a continuous process. The whole thing is a process. Living in health is a process. Like, you cannot put a tomato plant and forget about it and it's just going to work. It is a process. Whole nature is a process. So the process begins with your breathing. So you are sitting that way, somewhere you are comfortable. Maybe you are not so comfortable. Maybe you have some pain. That's okay. That's okay. But try to be as comfortable as you can and try to stretch your spine, okay? So that your pelvis is down, your sacrum is squared, and your spine is elongated as much as you can. Many of you probably had past surgeries, which is not allowing you to do that. That's okay. We are not looking at the disability, but what you cannot do. We are looking for what you can do. Okay? Pull up like that. So, or you try to correct as much as you can your slouch posture, and if you can hold your posture as much as you can. Because more you have posture, everything is kind of tied down from your stomach and all that up. And what do we really want? To open things up. That is the problem. Because once we get stressed or all this pain and all these things happening, it affects us, it changes everything, right? So we are opening things up. So I want things to be open.
What do you need?
Water.
Oh.
I have one probably outside. So what we are trying to do, we are kind of opening things up. That is the key. So we will try to do that for few seconds. Just sit there quietly and you just try to get a position as much as you can to open these things up. That is number two. So if you think you are in a good position, then we will start breathing. It is not very difficult. It is not rocket science. Third thing, don't think too much. Don't analyze too much. What I'm doing, just establishing a simple, small breathing pattern. This is what is being done actually in many respiratory therapists, but I'm trained. In India, we do not have any respiratory therapists. So I have done just physical therapy in intensive care unit in heart places or people after lung surgery for many, many years. When I was a student, and I still continue to do. We have patients, they will come here with a lot of lungs problem, they cannot breathe. And they come here for therapy. I said, if you cannot breathe, what therapy I'm going to do to you? So we need to normalize your breathing pattern first. Then only we can go somewhere else. So we normalize their breathing pattern first. So this is exactly what I do. I tell them to somehow, some way, somehow to sit down. Thank you. Some way, somehow to sit down this way, and now, like maybe on our treatment bed. Our treatment bed is pretty soft. Uh, we have it here, but it is firm enough. So I tell them to sit down there on the treatment bed, and then if they are supported and they pull themselves up, now they are open. Now the next thing we are going to do, so you can do this first with your eye open, but ideally if you can close your eyes, you will know how you are breathing. You'll be more aware about your breathing. So we will try to take a deep breath. Now, how we are going to deep breath? It is not forced, it is relaxed. So when you are doing relaxed deep breath, I am not going to do like that. Okay. So we are not going to put any kind of pressure or force in our nose, in our throat, nowhere else. Because what I'm trying to establish your diaphragmatic breathing. You are breathing from your diaphragm, from your tummy. So while sitting that way, try to put your hand on your stomach. So can you see my hand on my stomach?
Yeah.
Okay. Put your hand on your stomach. But this is what you are doing. You are trying to feel how your stomach is going to rise. Then you relax everything. Relax your shoulder, relax your neck, relax your head. Try to keep your chin straight or a little bit upright, never all the way down. If you cannot move your neck, that's okay. But if you can move your neck, try to keep it up, maybe slightly up, and put your hand on your tummy. Then what I'm going to do, I'm going to breathe it gently, yet very, very deep, as if I'm trying to fill my tummy with air. That's exactly what I'm trying to do. So this is what I'm going to do. I'm going to take a deep breath. Okay. After you take a deep breath, don't worry about hold. Those things will come much later. I want you to establish the first pattern. Before this, we cannot do anything else. After this, only we can improvise. Then things are going to happen. Things can improve. So we put our hand in here, and I'm going to relaxedly take a deep breath. Now, how do you know you are breathing deep? You need to focus how far your tummy is pushing your hand outward. That's why when you close your eyes, you're going to get more and more sensation because you are cutting down one of these sensations. And if you can keep your distraction to minimum, more you will be aware about your body. And this is what we lose once we become adult. We forget the awareness of our body. So we are going to put our hand here, we close our eyes if we can, then we breathe deep. Now your breathing is done. Don't hold your breath. Now you are going to breathe out. You are breathing out as if you are blowing a candle. Okay, so that we call as a pursed lip breathing. So we are going to close our mouth, blowing a candle, and you are breathing out longer than breathing in. So you are breathing out much longer than breathing in. So this is what it is going to do. It is going to slow things down. Rather than you breathing like that. And sometimes we unknowingly do mouth breathing. Unknowingly. We are not even aware that we are doing mouth breathing. So while you are breathing in, you keep your mouth closed. You are breathing in through your nose. Then you are going to breathe out through your mouth slowly and gently as if you are blowing a candle. But sometimes I find it difficult saying blowing a candle, you have to do like force, like that. But we are not doing that. We are doing very, very slow, as if we are blowing a candle. That is number one. Now, the question happens when you do breathe like this, how many times you are going to breathe? A good number is 6 times. Okay. Now, after you breathe for 6 times, check yourself. What is going on? Are you feeling dizzy? Are you feeling a little bit lightheaded? If that is happening, you are probably hyperventilating. So you can go down a little bit. So you can do 5 times. Okay. So whatever is the toleration is. So if you can do well and nothing is happening 6 times, then you can do it for 7 times, 8 times, maybe 12 times. If you're not feeling any lightheadedness or you are not feeling any dizziness. Okay. But the whole point of this thing, you are not forcing anything. You are doing gently. And how many times in a day you can do? Now this is the time you can do as many times as you can. There is no limit to it. More time you do, it brings awareness to you that how much you are breathing. Okay. And this is going to bring out more awareness. So you're going to breathe in through your nose, breathe out through your mouth. Everything has to be gentle. Everything has to be relaxed. Do as many times as you can. And if you have any family member with you, this is what I do every single day. We try to do more, but we are able to do more because there's quarantine. I have plenty of time with all of my kids. So if you have more family members around, put them together. It is not going to hurt anyone. Only it is going to help. If they are smaller kids, if there are little kids around, they can sit down, just be quiet. It could be a good family time. Sit down together. You breathe. This is the beginning of your breathing journey. You'll be more aware. But this is not just one thing. There are more other breathing will follow. But you cannot do all those before you can do this basic thing. So this is it. And if you have any comment or question, you can do it. I will try to answer as much as I can in future videos. We can go over more, little bit deeper breathing exercises, more advanced breathing exercises, which will going to be help. But this is the beginning. Actually, this is going to help you as a baseline, how you sit, how you open things up, and do a basic breathing exercise. This is going to help not only to reduce your pain, it is going to help you to sleep better. If you are having a lot of allergies, it is going to help you. That is a lot of good thing it is happening, and we know about all this thing for a long, long, long time. So please try to do this, and we will go more breathing exercises pretty soon. More I get time, I will do this more and more and more. All right. Okay, I'm going to stop it here. Okay, thank you for watching.